This is our lecture on pharmacology. We are talking about neuro drugs. Okay, let's begin. So, for neuro drugs, we will talk about first psychotherapeutic drugs. Okay, and then later on, we will talk about another group of drugs. But for now, let's start with psychotherapeutic. So let's break down first the word psycho and therapeutic. So in our previous discussion, we said therapeutic means something to fix. Okay. So these kind of drugs are given to fix something. And what is it gonna fix? The word psycho means behavior. Okay. Psych means behavior, but the behavior is coming from the work of the mind. Okay, so psycho means a behavior that originates from the thoughts or from the mind. Thereby, when we say psychotherapeutic drugs, that means we are talking about medications that will fix something in the behavior which the origin is in the mind. And that also further tells us that these medications are gonna do something in the brain so that the thinking process changes. And because the thinking process changes, then the behavior will also change. Okay, that's why we call it psychotherapeutic. Now, having said that, okay, so we are going to talk about three types of medication. You have your stimulants, antidepressants, and antipsychotics. Okay, stimulants, antidepressants, and antipsychotic. So just by the word of these words, let's try to analyze. Okay, so when you say stimulants, this medication is gonna bring about some form of excitement. Okay, so the question is, why bring some sort of excitement? So then we go back. That means this person may not be that active, okay? Because we need to put this person into an active behavior. Okay, so that gives you already an idea. Okay, so we're talking here about behavior that is not active. That's why we're gonna activate the behavior. Another group of drug, your antidepressants. So this drug is gonna work opposite to depression. It's gonna bring a person from depression to the opposite of it because it's antidepressant. So now that means you're gonna be working with a person who is depressed. And this is a drug we give them so that they move from being depressed to the opposite. And then the third one is antipsychotic. So the question is, what do you mean by psychotic? Now, psychotic behavior are usually characterized by delusions. Okay, what are delusions? Those are false beliefs, and because of these false beliefs, the behavior is not also appropriate, and so we have to change or address this false belief, slow down this false belief so the behavior is also minimized. This not normal or not real, the inappropriate behavior is also addressed. Now, before I proceed further, there is a video. I want to show you this video so that it will enhance our discussion. Okay, so let's see. Okay, so that is a brief overview of the three drugs. Okay, the stimulants, antidepressants, and the antipsychotics. Okay, so let's proceed with the discussion. Now, let's give the formal definition. When we say stimulants, these are drugs that increase central nervous system activity. So when the brain is activated, that means these drugs bring about alertness, a surge of energy. Now, I want you to pay attention to this terms, dopamine and norepinephrine. So these stimulants will block the reuptake of dopamine and norepinephrine. Thereby, it will increase the neurotransmitters. So when you say increase neurotransmitters, transmit, there will be more transmission going on, more passing on of stimuli. So that's why there is increased activity, increased thinking. These medications act like sympathomimetic, the emergency drugs. Okay. And with that, the signs and symptoms that it will also have are everything that is like you're running. Their increased heart rate, the pupil dilates. Okay. Now, with pharmacology, I want you to start familiarizing with medications, names. So for stimulants, the most common is this Ritalin. Okay. Ritalin is used to improve attention. So this is common drug for those with attention deficit problem. And for people with fatigue, this can also, lighten up, increase energy. Another stimulant are your amphetamines. Okay, amphetamines, they boost thinking process. They boost memory, makes a person more alert, and the mood becomes, jovial, happy. Okay, but take note, amphetamines in overdose can actually lead to death because it can affect the heart. Okay, so, and also when there's excessive amphetamines, it also messes up the brain and can induce psychosis. And what is psychosis? These are your um, delusions, your hallucinations. Okay. Um, so, what are some key things to remember about stimulants? They are the medications used for people with ADHD. Again, what's ADHD? The attention deficit problem. And it can also be used in conjunction or in partnership with your psychotherapy because, as we said, this brings out a person's thinking process. It becomes more active. Okay. And so people with thought problem can be helped with these stimulants. Now, take note, stimulants are controlled substances because it has a potential for misuse because it can be addicting. Okay, so unfortunately, there is a high rate of misuse among college campus students and professionals. Okay, and then this stimulants um, is prescribed for those with ADHD and may actually reduce risk of tobacco and substance use later when properly used. Okay, so let's be more specific now. Okay, with stimulants. So we already talked about the amphetamines. Okay, then we have another drug that is common as a stimulant, the Vivance. How to remember? Just think about Viva, alive. Okay, so this is an upper drug. Okay, common drugs are your Ritalin. Again, it is emphasizing here, it inhibits the reuptake of dopamine and norepinephrine. I think these slides simply repeats what we talk about. Now, when a person is so stimulated, he keeps walking around, keeps thinking a lot, chances are this person will not eat properly, and so weight loss could be a major problem. Or anorexia, no appetite, there's too much energy, cannot sleep because the brain is super active to the point of being having headache, being irritable. Now take note of the heart. It's tachycardic, because it's over stimulated. That's why we gotta be careful with these stimulants with people we are having heart issues like hypertension, metabolism problem, bipolar, because this really is an upper drug. Okay, it hyperactivates a person. It also hyperactivates the brain. Definitely, that's why we are careful with people with history of seizure. Okay. Now, these are strong drugs. So, what did I say? With strong drugs, we always monitor liver and kidney function. Okay, liver and kidney function, because liver issues. These are the liver detoxify our chemicals, and then the kidney will filter waste. So we are really putting kidney and liver into big use. Heart, this is a stimulant, so we gotta monitor the heart. And what did I say earlier? Since the person is super active, he may forget to eat, so let us assess appetite, nutrition. Person may not be able to sleep, so we gotta make sure he would calm down and avoid as much as possible caffeine use, because that just add to the stimulus. Okay. So we gotta educate our client that this drug is purposive. It's for specific symptoms like ADHD, and so it is important that it is used according to how it is prescribed. Okay. Now take note, since these drugs have major effect on our brain, we follow strictly as prescribed, and we do not just stop taking it. It has to be tapered off. There has to be some guidance on how to stop this medication. And then this drug can be addicting, and so somebody else may also want to take it. So make sure this is stored properly, and always monitor vital signs because of the fast heartbeat, the insomnia, the changes in the mood. Okay, so that's your stimulant. Then we have the antidepressant. What did I say with antidepressant? You're dealing with a person who is depressed, and you wanna increase, the activity. Now take note. Earlier, there was a mention of dopamine and serotonin. Kind of work the same, but this time it is really specific. It works with this serotonin in our body. Okay, it inhibits the reuptake of serotonin. Why? Serotonin is the happy hormone. Okay, so if the body does not reuptake it, then it is provide in more supply. Okay, it stays more in the blood, and thereby when it stays more in the blood, it brings about the happy mood. Okay, and other classes of antidepressants, you have your tricyclic antidepressants, you have your monoamine oxidase inhibitor. So if you see these terms, think about happy hormones. So whenever you see the word serotonin, serotonin makes you happy. Okay. Um, makes you happy. So if you look at the function, it says It blocks serotonin transporter. It's not blocking the production of serotonin, but rather it's blocking the transport of serotonin so that it will increase in the bloodstream. Okay, it stops the reuptake of serotonin. Another happy drug is norepinephrine. Norepinephrine actually is a medication that calms down a person. So think about that. That's why it's an antidepressant. It brings good mood. Okay, so think about those terms, because in pharmacology there could be a lot of medications. So you gotta spot what is really, really more generic, um, closely linked to the function. So indication, we say that it's an antidepressant, so it's really for people with major depressive disorder and even those with anxiety disorder. Now, those with anxiety disorder can have panic, can be having eating disorders as well. So we still give these antidepressants to calm them down, to improve the mood, and take them out from a depressed situation. Now, what do we remember as nurses when we give these meds? One major thing is GI upset. So, um, we give our client a heads up already that those are part of the side effects. Um, One can have headache, insomnia from these antidepressants. The most notable in antidepressant is increased sedation. Okay, since the person would feel calm, okay, feel calm and slowly get out from that depressing mood. There's a tendency that the person will overeat, okay, as an effect. Um, to relax, okay, that's your increased sedation. Although it would be more of headache because there is it's more of a stimulant, okay, this antidepressant. Okay, now some cautions on specific meds. Okay, watch for serotonin syndrome. Okay, serotonin syndrome, there is effect of the serotonin, which can lead to increased sedation, weight gain, orthostatic hypotension. Okay. Now, another thing is, which I already said, avoid tapering. No, not avoid tapering, but make sure meds are tapered. Okay. Um, do not abruptly stop medication. Okay. Now, this SNRI, now there are some antidepressants that are not good for elderly patients because of the cardiac effect of this medication. Okay, so having said that, we always do an assessment. We look at baseline ECG. So if you notice these drugs that are like uppers, stimulants, antidepressants, it tends to affect the heart. Okay, now why suicide risk? Okay, now, when a person is super depressed, he doesn't, he is not hopeful about life. He is depressed, so he could be thinking about suicide. But when a person is depressed, he may not have the energy to carry out the suicide plan. Now, take note when he starts taking this antidepressant, there is a surge of energy. Okay. So now he gets to, the thinking process improve. Now, what's the danger there? The negative thoughts about oneself may still persist, but he has now the energy. So this is actually a suicide risk time because now the person can actually execute whatever he's planned to commit suicide. So people on antidepressants, we put them on suicide watch. Okay. Also, we educate the client that if this is the first time he's gonna be taking the antidepressant, it doesn't work like overnight. Okay, the effect can be felt maybe in the next 2 months, okay, 6 to 8 weeks. So if after taking like for a month and the patient feels like there is no effect, okay, caution the patient. Okay, it doesn't work that fast. It may take more weeks before the full effect is being felt. And what did I say with antidepressant? It can affect the stomach. Okay, so it can upset the stomach. So it is important that in taking the meds, the person does not take it on empty stomach because it does cause upset stomach. So something to take it with food. Okay. And what did I say? The serotonin syndrome. Okay. That is when the person is super stimulated. So the heart can be tachycardic, the blood pressure can be super high. Okay. It's like super happy. Okay. Now, and the last group of meds, we have the antipsychotic meds. What did I say with antipsychotic? When we say psychotic behavior, these are your based on unrealistic thoughts. That's why the behavior is not appropriate. Okay, so these are for people with who are schizophrenic, with bipolar. So when you say bipolar, that is a swing of mood from depressed to manic, then manic to depressed. But on top of that, okay, it's not just about feeling, there is a behavior. Behavioral symptoms such as agitation, delirium, symptoms like in dementia, like forgetting about himself or having a false belief. Okay, having false belief. Okay. Now, in terms of drug classes, these antipsychotic drugs, you will see keywords here. It blocks dopamine. Okay? It blocks serotonin receptors. Why? Because these psychotic drugs will try to reduce, okay, the abnormal behavior. So, um, what are those abnormal behavior? I said delusions. What is delusion? False belief. He thinks he's Superman. That's a false belief. Or he thinks he can fly. Okay. Or she thinks there is an alien talking to her. Those are delusions. When you say hallucinations, that is seeing something differently. For example, there is a rope on the floor, but the person who's hallucinating will see it as a snake. Okay, or some there's a cloth in a clothesline and it's flying in the air, and the person with hallucination interprets it as a bird. Okay, so there is a stimuli but it is interpreted wrong. Okay, so that those are psychotic thoughts and psychotic behavior. So behavior would be, since he thinks he's Superman, is gonna jump off the building, or he thinks an alien is following him, and so he's gonna be hiding all this time inside a cave. Okay, so those are psychotic behaviors. So medications are, you know, those chemical in our body that regulates the thinking process are now being um, regulated. So what are those chemicals? We go back to your dopamines and serotonin. So if you notice, we always repeat same chemical that is affecting our brain, dopamine and serotonin. So for certain formulations are of this medication produces symptom relief. Okay, so instead of being anxious and confused, person will start to calm down, and the delusions and the hallucinations hopefully are also gonna be in check as the mood stabilize. Again, what did we say? The effect is not immediate. It may take about 4 to 6 weeks up to 8 weeks before the person will start to feel the effect of the medication. Okay. Now, other effects of these antidepressants are more on weight gain again. We also have extra pyramidal symptoms. What is that extra pyramidal? It's like the jerking movements. It's not really the normal voluntary movement. These are like extra movements of the body. And I think it's because of the drugs having an effect on the synaptics. What do you mean by synaptics? The junctions, the connections from one neuron to the other. Okay, so there's extra jerking movements or extra slowing down. Okay, um, abnormal extra behaviors. And then nursing considerations would be, again, you monitor the vital signs. Okay, educate on metabolic risk. These are strong medications that affects metabolism, so liver and kidney will always be in a close watch. Now, one thing we have to be careful with is a granulocytosis. What does that mean? This is a problem in our white blood cell, okay? Because the medication is super strong, it can affect our blood cells. So, but it's rare, but something that we closely watch, okay? Again, we counsel our patient and family about adherence to the prescription. Okay, if it says take it this number of times, we encourage our patient to really strictly follow so that it will produce the desired effect. Again, you do not stop the medication abruptly. Gotta consult the doctor and make sure it's tapered down. Okay. You noticed again the check on the ECG because, again, these drugs, because they are uppers, have major effect on the heart. Okay, so those are your stimulants, antidepressants, and antipsychotic drugs. Let us go to another group of drugs. They're very similar. In fact, it's hard to distinguish one from the other. Okay, but they're termed based on what it is trying to control or reduce. Okay, so one is anti-epileptic, the other one is anti-seizure, and the third one is anticonvulsant. So actually, they're almost the same, and they're even similar to what we just talked about. Okay, if earlier the first three groups, okay, if you remember, if I will just compare the difference. One is stimulant. Okay, the first group, stimulant, antidepressant, antipsychotic. So what group of med is that? It's bringing out the person, making the person happy, alive, active. Now, if you look at these meds here, it says anti-epileptic, anti-seizure, anticonvulsants. It's against epilepsy. It's against seizure. It's against convulsion. Now, what is common with epilepsy, seizure, and convulsion? You think about the brain cell. The brain cell, when a person is epileptic, is firing fast. Okay, abnormal firing fast. Okay, it's hyperactive brain. Okay, so seizure, what happened to the seizure? There is abnormal passing of stimulations also in the brain. Okay, anticonvulsant, that means the person is convulsing and you need to stop the convulsion. So again, If you notice, those three drugs are slowing down the brain. Okay, so we're looking now at downers. Earlier, you have the stimulants, the antidepressant, the antipsychotic. They're generally considered uppers. You know, it perks up the person. It made them think more. It made them process their thinking. While this group here that you're looking at, it is assumed that this person have so much brain activity going on, that's your to the point of being abnormally firing. That's your epilepsy. Okay, people who have those tendencies, epileptic, or when there is like electrolyte imbalance, and so these brain cells are gonna be reacting too fast. That's your seizure. And then preventive meds. Okay, you don't want the brain to go hyperactive, so you're gonna give a something that stops it from hyperactivity. That's your anticonvulsant. So these are actually downer groups. I like to call it downers. So let's start with anti-epileptic. Okay, there's a video here I wanna play because generally it will right away link us to a lot of things. Okay. All right, let me skip first this. Let's stop this ad. Okay, let's skip that. Okay, all right. Okay, so I stopped the video because I think that's enough backgrounder already on what we were talking about. So now I know you feel like, what was that? Okay, I that's a lot of concept. Okay, don't worry so much. We are not pharmacists, we're not scientists. All I want to highlight in that video, when you say that, if you notice, it was telling us that there is some mechanism in the brain that either excite or inhibit or stop. Okay. And when there is seizure, that means there's an abnormality between exciting the brain and slowing down the brain. Okay. So that's why a person goes epileptic. And then there are also mentions there about sodium and chloride. Okay. So that's a very, very tough concept. That's actually metabolic imbalances, electrolyte imbalances. So takes a lot of reading and understanding, so you can get that. But for now, for pharmacology, just focused on there's an electrolyte balance between sodium and chloride. In other words, we have a messed up electrolytes in our brain, and because of these messed up electrolytes and chemicals, there is abnormal firing in the brain. And so we need medication to regulate this abnormal firing. So you can see here, this anti-epileptic stabilizes neuronal membranes and suppress. Okay, so it suppress. When you say aberrant, aberrant means abnormal electrical activity. Okay, so I want you to be familiar with these three drugs, okay, anti-epileptics. Um, Tip for pharmacology, nursing, familiarization. You do not need to really memorize, but you need to be familiarized. Like when you see phenytoin, think of drugs that calm down, okay? Calm down, okay? Barbiturates, it calms down. Benzodiazepines, it calms down, like diazepam, clonazepam, okay? So in pharmacology, it's important you keep reading and familiarize with drugs. And so you might ask, how do we memorize all of this? Okay, unfortunately, we cannot. We can only be familiar with it because our role is nursing, which is giving meds. And but don't worry, in real life practice, we don't memorize. When we are given a drug to give, we give our drug book, we read about it before we administer it. But since we have pharmacology exams, so you gotta start familiarizing with it. Okay, that video also mentioned GABA. Okay, that is an inhibitory neurotransmitter. Okay, and so this anti-epileptic enhances the inhibitory transmitter, meaning it favors GABA production because GABA tends to regulate the brain activity. So it slows down the brain. Okay. So some considerations. Okay. We said the phenytoin. Okay. These are for those with seizures. Okay. Um, One thing though with these brain meds, you it's easy to get overdose, okay, because a little, excess amount can have a major effect. And so what is an important nursing reminder, we need to check their blood always. This patient, check if the chemical that we're giving is still in a safe dose, because when it goes overdose, like for instance this phenytoin, the therapeutic dose is only from 10 to 20. So when it goes 21 or 22, see, it's very a small difference only, a little bit extra, it's gonna be toxic already to the person. Okay. Now, specific for phenytoin, it can cause gingival hyperplasia. So a usual NCLEX question would be, here is a person having seizures. He's been on Dilantin for quite a while. Come in with complaint of pain in the gums. And right away we say, okay, we link phenytoin with gingival hyperplasia or the uh, inflammation of the gums. Okay, so there's pain in there. Okay, so that's your thing in pharmacology. When you read more notes and look at more questions, there are specific drugs that it highlights because why they highlight on these drugs for nurses, because they have these side effects that can be dangerous to the patient, can be bothersome to the patient, or not your usual side effect that the patient will be like um, confused why he is manifesting that. So it's important that we educate the patient about those things. So you see, in pharmacology, what you need to study are your general safety precautions. And if it has to be specific to a drug, what makes that drug unique in terms of what should a patient should know about those drugs. Okay. Another common drug in your anti-seizure is this levetiracetam. Okay? Levetiracetam, that's actually your Keppra. Okay? Um, it's an adjunctive therapy. When you say adjunctive, it's not the only one. It is usually given with other medication. Now, careful with your Keppra because a person can be suicidal because in the thoughts when given this anti-seizure drug. We also have this gabapentin. That's your another drug. It it works with the calcium in the body. Okay, works with the calcium in the body. You see again the suicidal thoughts. As I said, generally this group of drugs are downers. Okay, the earlier those upper drugs, the problem there is the person now have the energy to commit the suicide, while this medication here, these downers, the person go depressed and will have those suicidal thoughts. Okay. Other your other drugs are your phenobarbital, okay, and then your ethosuximide, okay, phenobarbital and ethosuximide. Okay, again, you see here nursing consideration. These are drugs for the brain. You do not stop it right away. You need to taper off. Okay, you see again your labs for your liver and kidney. We monitor blood tests. Okay, so it's always similar from one drug to the other when it is medication related to the brain. Okay, um, safety precaution because this person can suddenly have seizure and fall. Okay, definitely when taking medications that is targeting our brain, we avoid alcohol. Okay, and follow closely the medication schedule. Now we go to the anticonvulsants. Okay, anticonvulsants. We have here valproic, carbamazepine, lamotrigine. Okay, then you will ask me, ooh, should we memorize that? Unfortunately, you start familiarizing. That's what I said because in NCLEX, they can just put their carbamazepine. And then you ask, what kind of med is this? But if you keep reading the names of meds, now you start saying, okay, this is a downer drug. Okay, that's how I do it. I don't really actually memorize. I just group these drugs together. Okay, so now specific for anticonvulsant, if you notice it's more of a preventive drug. Okay, it's more of preventive drug. See, you see here, it's a maintenance therapy, prevention of relapse. Meaning, we give this medication to prevent the occurrence of convulsing. Okay, the other drug is like anti-seizure. There's already a seizure going on, and then you give the drug to stop the seizure. While this one is to prevent the occurrence of convulsing. Okay, so this is more of like lithium. Okay, another example is lithium. It is a long-term drug for stabilization because it's a preventive drug. Okay. Now, usually, the anticonvulsants are given together with antipsychotic drugs because this is again this is a downer. So if we're giving antipsychotic drug which kind of stimulate, at the same time we also balance it with a calmer drug. Okay, so that's how it works. They work in conjunction. Now, lithium, be very careful with lithium because the therapeutic range is very narrow, meaning one can easily get poisoned with lithium. So we monitor lithium level in the body. Look at the drugs again. We have carbamazepine, lamotrigine. Okay. Um, these are your anticonvulsants. So these are more for preventive. Okay. And specifically, these are effective for your bipolar depression, a mix of depression and manic. What did I say with lithium? Very easy to get toxic because the therapeutic index is, look, it's from zero point 0.6 to 1.2 only. Okay, so we need to do drug testing every now and then, blood testing, because if one gets overdose, it can be very fatal. Okay, um, again, you have here your medication. So there's so many things to remember. I will say just read and read again this material. No need to memorize. Just read and read, and then take note of the things that I highlighted. Okay, that's how you study your pharmacology. You tell yourself, I cannot memorize all of this, um, but I will get familiarized with it. Okay. Now, look at the labs. You see there again your liver and kidney function, the monitoring of your medication. Okay, so it's almost it's the same precaution that we apply, uh, because these are drugs that affect the brain. Okay, and then as always for safety, we report signs of toxicity. Now, if you notice, for any drugs that affect the brain, we monitor sodium and calcium. Why? What did I say with sodium? Sodium is maintain fluid balance, and then calcium, it's actually for electrical activity. So when you have imbalances of sodium and calcium, then expect for fluid imbalance and electrical activity imbalance. And remember, brain is an electrical activity, so then it affects thinking process when this sodium and calcium are not in normal values. Okay? Now, some of these drugs like valproate is teratogenic. What do I mean by teratogenic? You cannot give it to pregnant women because it will interfere with the formation of the organs of the fetus. It can destroy the organs of the fetus. So we also remind our client if they are female, before they actually take these meds, we check, are you sure you're not pregnant? We may need to do a pregnancy test if they are young women in fertile stage like you guys. Okay? And then finally, we have your anti-seizure drugs. Okay, anti-seizure, if you see, it's also called anti-epileptics, can also be called anticonvulsants. So basically, they're like same group of drugs. They interchange. It's just that they have specific actions, but the effect is the same. Okay, so here, if it's an anti-epileptic, anti-seizure, very specific. They work in our sodium and calcium channels. At the same time, they also enhance the GABA. Okay, so you see, they are the effect is the same. Okay, um, the they stabilize the neuronal activity, and when the brain activity is stabilized, the mood is also stabilized. So drug, you see the word phenytoin, the therapeutic range is repeated. Okay, we have other drugs, carbamazepine, that's already mentioned earlier, valproate, lamotrigine, ethosuximide, and your levetiracetam. So you see these drugs are repeatedly, some are present in one category, some are not, but you can all group together your anti-seizure, your anti-convulsants, and anti-epileptics because generally they work the same. They are downers. Okay. What do you monitor again? You monitor your liver for hepatotoxicity. Okay. Um, you also monitor your electrolytes, specifically your sodiums, okay, because it does affect the neuronal activity. This drug, ethosuximide, has an effect on the calcium. Okay, and so we monitor calcium level as well. What again is calcium? It's for the electrical activity. So you see, it is closely linked with the seizure. Okay, um, levetiracetam, that's your Keppra that I mentioned earlier. Again, the function is modulation of GABA. GABA, remember earlier in that video, GABA is if we have chemicals that excite, we also have chemicals that inhibits in the body, and that's your gamma. Okay, now you're dealing with drugs that interfere with the chemicals epinephrine, norepinephrine, dopamine, gabapentin. These are chemicals that are linked with our feelings, our mood. And so when we're giving meds that affect feeling, mood, and thinking process, expect for behavioral changes. And we gotta monitor because we'll hopefully what we intend the drug is for, is it to perk up the person or to calm down the person? We see if it's working as expected with a person. Okay. Again, monitor the liver and suicidal ideation because of the changing mood. Again, I go back. The first group, which is your antipsychotic, um, antidepressants, stimulants, these are your uppers. Uppers. It excites a person, so we've got to be careful with suicide because they may now have the energy to execute it. On the reverse, your anti-seizure, anti-convulsants, anti-epilepsy, they are downers. Okay, when drugs are downers, it may make a person feel sad and suicidal too. Okay, and so we don't know how much energy that person would have to execute any uh, you know, self-harm thoughts. Again, repeat, never stop abruptly this type of medications. And so this is applicable to all taking the anti-seizure, anticonvulsant, anti-epileptic drugs. They use medical alert ID so that in case they convulse, the people would know this person have that condition and would know how to manage. Okay. Again, alcohol, avoid. Okay. And anything that interferes the brain, we want to avoid that because we do not want to add already to the medication that is affecting the brain. Okay, so we end up here. There are other videos that you can watch to help enhance your thinking, your understanding. We have here for anti-seizure, we have 8 minutes. You can do that on your own. We also have here a video on anticonvulsants. That's about 9 minutes. You can do that on your own. Another one is this we watch the anti-epileptic video, makes you understand or have a visual on how these sodium chlorides and GABAs are working to regulate the firing of the brain. Okay, so that was our anti-epileptic, anti-seizure, and anti-convulsants. Now we have other two videos here that you can work on and watch for yourself. The antipsychotic drugs, that's about 9 minutes. These are your uppers. We also have these antidepressants, that's about 11 minutes. You can watch that. Okay. And another one are your, which I think we watched that, the stimulants earlier. So that will help enhance your um, concept. So I would suggest in studying, okay, these psychotherapeutic drugs. These are drugs that affects the brain, and then because it's affecting the brain, the thought process, the mood, then there is also a change in behavior. So um, read again these slides, and then I would suggest click on those links that I provided so you listen to them. I don't expect you to be memorizing things, but I want you to pay attention to what is being said so that when you now take the test, things are familiar to you. Okay, so I'll end up here our discussion for this lecture. Thank you very much.